moving on. So this is our equine dentistry episode, which I'm pretty excited about. Dr. Bess is amazing. She's done my horses in the past. And I thought she was, she's even got for those of you who aren't watching but listen later, she's got a whole horse skull, which is very exciting because I feel like we're going to get to see some things here. Okay, so before we get started on any questions, I will let Dr. Bess introduce herself because she's pretty cool and has a really neat background. So, Dr. Bess, go ahead. Tell us about yourself, please.
Okay. Well, my name is Bess Darrow, and I'm a veterinarian and a dedicated equine dentist in Ocala, Florida. And I've been at this for about 30 years. I started out as a trainer, a pony club kid, a horse lover. Then I got into equine dentistry as a consolation prize the first time I didn't get into vet school. So I encourage all of you to, if you're aspiring equine dentists, go to vet school. It took me a few times to get in, and then I had already fostered this interest in equine dentistry. So it was something that not a whole lot of people talked about, and it was really an underserved field. People weren't doing it very much. The vet with one little rasp in his bucket was usually the guy that everybody called. And when I learned how much more there was to it, I just was hooked. So I attempted to be an equine dentist without being a veterinarian at first, and I found it to be extraordinarily difficult for lots of reasons. One, that you can't sedate horses legally, and because you don't have the knowledge base of being a veterinarian. So I continued my journey on to vet school and decided I could do as many things as I wanted. I thought for a second I might be a small animal emergency vet, but that didn't last very long because it kept coming back to equine dentistry. So I just think it's a passion. It's something that is very black and white. To me, it's something like the horse either has a sharp point in its mouth or it doesn't. There aren't very many gray areas. You can fix them immediately most of the time. It's a very rewarding job. And the more horses that I looked at, the more horses I found who had problems, and I could fix them. So it became this process of I just kept wanting to see as many as I possibly could so I could fix them. So 30 years later, and hundreds and thousands of horses later, I'm still at it. And I always tell people, every time I go to work, I think I'm probably going to have seen everything that I could possibly see. But then I just go to work another day and I see something I've never seen before. So it's not really monotonous, and it's not boring at all. It's very interesting. So that's how we roll. I'll tell you how we roll. I happen to work out of a mobile equine dentistry trailer. And so we're mobile, we're solar powered, we have everything we need in our trailer. And we just show up at people's houses and take care of their animals, their horses.
Yes. Which is really cool. I hadn't seen that before, and I moved here and you rolled in with that thing, and I was like, wow, that's so smart. Like, it makes so much sense.
Right. I think that there are three things that you need specifically to be able to do equine dentistry, and I'm non-negotiable about this. One is you have to have proper restraint for the horse, and we use that set of stocks within the horse trailer, but you can do that in a stall or in a vet clinic. You need a bright light, and you need a speculum, the device to hold their mouth open. So if you have those three things, you can do an adequate or excellent exam on the horse. Otherwise, I will say I'm full of stories, but one story is that I met an old school veterinarian not so long ago, and he said, "Oh, I've heard about you, and I was wondering if I could just watch you for work for a minute." And he came in the trailer, and he was looking over my shoulder, and he said, not at all what I thought he was going to say. He said, "Oh, you use a light." That's great. I have a very bright light that's on a magnet that sticks onto the speculum so I can have a perfect view of their mouth. And he said, "I just stand them in the sun and let the sun shine in there. That's my light." So I say that we've come a long way. We have come a long way. We don't have to do that anymore.
Yeah.
Anyhow, so I just tootle around the countryside, taking care of all the horses and ponies and donkeys and mules that I can. I love it very much. It's a wonderful, wonderful job, and I'm blessed that I can do this for these animals. So what are your questions?
All right. You ready? We've got a few, and then of course, if you guys want to submit any in the chat as we go along, just drop them in there and I will ask her when we get to it. but I have several that I came up with, and then we have a bunch of viewers submitted. I like having you to myself because I get to ask you kind of fun things. But okay, we'll start with something simple. What are common signs of dental problems in horses?
Nothing. One of the most common signs of dental problems in horses is that they do absolutely nothing and have absolutely no clinical signs. Next. No, I'm not really kidding. I'm very, very serious when I say that really my mantra every day seems to be the horses with the worst problems show you nothing. These are prey animals that are not supposed to show when they're sick or hurt, and they do a very good job of covering it up. Most horses. I mean, you'll find the ones who are more sensitive, and they step on a rock and they hold their foot up, and you have to help them, and the type. But the average horse who has a major dental problem, the owner probably wouldn't even know. For example number 752. This happens daily. We had a horse the other day, and as I was opening her mouth, I found a little bump on her lip, and the owner said, "Oh yeah, she had that little tiny bump on her lip. It was about as big as a pencil eraser." And she did that about 2 weeks ago. I'm not sure she did it in the field, but she's fine. And it was just a healed tiny little lump under my fingernail. But when I opened up the horse's mouth, she had a hole about 3 fingers across in her lower lip that had been healing for 2 weeks, and it looked like she had shoved a giant tree branch into her mouth. And the owner said she never missed a meal, she didn't have any bad breath, she wasn't sensitive to be ridden, and she did not have any idea whatsoever that had happened to this horse. So case in point, the horse said nothing. She didn't want you to find out why she was hurt. I don't know what she was doing with her friends in the pasture, but anyway, but seriously, if you do have a horse that has dental problems, what can they do that would make you think that they have something wrong? Very obviously, bad breath. That's a big one. Swollen cheek, if you go out and their faces are swollen like a chipmunk on one side. Excess salivating. Horses don't typically salivate extra from their mouth unless maybe some of them are ready for dinner or you're giving them a cookie, but they shouldn't have a lot of saliva running out of their mouth. No discharge from the nose. Horses who do things that they never used to do. So I think I go through my career just dispelling all these myths. People think that horses who drop food have dental problems. And if I had to try to think of what's the number one concern that people have, they call and they say, well, my horse is dropping food, so therefore he needs his teeth done. Or the opposite of that is, well, my horse is not dropping any food, so therefore I know she does not need her teeth done. But that is really irrelevant. So how it works is horses, in my experience, and I think I'm right on this, horses are either distracted eaters or they're really good eaters. Distracted eaters take a mouthful of food and then they look around and they're trying to decide who's going to take their food. And they're looking over their shoulders, and maybe they are in a field of other horses who might take their food. But you've seen them do it even in their stalls. They take a mouthful of food, they look up, they chew with their mouths open, they drop all their food, they look around, and then they take another bite, and later on they finish it off the ground. Those horses typically don't have dental problems. They are just distracted. Then you can compare that to the other horses in the barn who might put their head in the food bucket, and then they keep eating and eating and eating, and then after they're done eating and they haven't lifted up their head and they lick the bowl 100 times and they've gotten every grain and they go over it again, that's a non-distracted eater. So if you have a horse who always drops grain, it probably does not have a dental problem. If you have a horse who never drops grain and then all of a sudden they are just gobs of food is falling out on the ground, then that is note for concern. So if you've never heard the word quitting, that's like Quidding. That means when a horse takes a bite of food and then drops it out in wads. You can quid grain and you can quid hay. It looks like just tufts of hay or pieces of grain all over the place. So quitting is a good sign that something is wrong. That means that they're not chewing correctly. Now, they might quit if they have no teeth, if they're old. They might quit if they're a young horse and they're trying to lose a baby tooth. Or they might quit if they have a stick stuck in their mouth. Or they might quit if they don't like their hay. It's very stemmy. And you have to remember that too. Who doesn't have a picky eater in the barn? There are picky eaters. And sometimes I go to see a horse and they're just sure something's wrong. And then I say, well, have there been any dietary changes? And they said, yeah, we got this new load of hay. Well, guess what? They don't like the hay. And so they chew it up and spit it out. I mean, that's very simple. That happens a lot, actually. So there are a myriad of things that they can show you that something's wrong. And as far as riding is concerned, if I could fix all of your riding problems with dentistry, I would be the most popular person in the world. But I can't fix certain things. Some I can, some I can't. So here's an example. A friend of mine has an event horse. He's 14 years old. He's a good boy. He's never done anything wrong in his life. She went to get on him. She got on the morning block. He took a step forward. She pulled her reins back and said, whoa, no big deal. And he reared straight up and he almost flipped over backwards. She got off of him and she called me and said something is drastically wrong. And that is a behavior that wasn't there yesterday, which is there now. And that horse would never normally do anything like that ever. So I came and looked at his mouth and he had a broken tooth right where the nose band crossed over his face. And it recently happened, like maybe that morning or the night before. And a section of his tooth had popped off and then it was stuck inside his cheek. And when she tightened her nose band, it was right over that. So when she pulled back on her reins just a little bit, he said, peace out, I can't handle this. It was that painful for him. So that's, a change of behavior that would make you think that something is drastically wrong. What I cannot fix, pulling. I cannot fix your pullers. I wish I could, but that is not a behavior that horses typically exhibit when they have a dental problem. I mean, think about it. They typically are going to be more backed off. They're going to be more backed off of something because they don't want the contact. They're not going to push into something or pull into something that hurts, usually. Most of the time, I can't fix your left-handed or right-handed horses. Sometimes if they have a sharp point on one side, it will be more difficult to turn one way or the other. But most horses are one-sided, or it sort of changes through their lives or their training, but they tend to be more one-sided than others. Here's another example of, yes, this horse has a dental problem. I was sitting there at work, eating lunch, watching somebody ride their horse in this arena at a barn that I was working at. And I saw this horse jumping all over the arena. And I don't mean over the jumps. I mean like jumping, caprioling all over the arena. Every time she started to turn right, this horse she would jump up in the air and like a porpoise almost, jump away from whatever direction she was supposed to go. And I thought, this is crazy. This is not a young horse. This is a middle-aged warm blood. She's just a nice hunter. Why is she doing this? And I'm somebody who never stops talking. I just went up to her and said, hey, it's none of my business really, but I'm here. Would you mind if I looked in your horse's mouth? Because this doesn't look like normal behavior. And she was very frustrated. So sure enough, when I opened up her mouth, she had a ginormous point in the back of her mouth that had made an ulcer about the size of a tennis ball. And every time the rider pulled the right rein, it was jamming that point into the ulcer. And that horse she was trying to be good, but she just couldn't handle it anymore. So that's like an extreme behavior. That horse got fixed right away. I mean, that was an easy fix to take that point off. But that type of behavior. But people call constantly with, well, my horse won't turn to the right. He's stiff to the right, or he pulls to the right. That's just not really the kind of thing. Now, I'm not saying that all horses, especially horses that wear tack and are ridden, don't need to have their teeth checked regularly. They sure do. But if it makes sense, it's just not all these little riding issues just can't possibly be their teeth. But it's a good place to start. It's a wonderful place to start. It's the first place you should start. Yeah. Another thing is that a lot of times when horses are frustrated, annoyed, or painful, or anxious, they flip their heads. If you've seen that behavior, they flip their noses up in the air. And I don't see too much of that with dental problems, but I definitely see it when their backs are sore, when their saddle doesn't fit, when their stifles are sore, when their hocks are sore, or when they're just in general frustrated with their situation. They toss that head, even when you're leading them, not even with a bridle and a bit in their mouth. You can see some horses do that. That's just anxiety, frustration, and then I have people call, well, my horse flips his nose. And I say, is he an Arabian? Oh, no, really. But you know what I'm saying? Like, that is usually something else. But all of those situations is worth a look. There's no charge for looking. It just takes a few seconds to check it out. And then, like the mantra, there are so many horses in the world who have horrible mouths who they're used to it and they don't complain about it and they don't tell you. One thing about teeth in general is that unless it's an acute injury, these things, malocclusions and the ways that teeth go together and they don't fit correctly, conformation problems and hooks and ramps and waves and all these things we can talk about later, those didn't happen overnight. They happened a fraction of a millimeter by fraction of a millimeter over time. And that horse got very used to that. It's not a shock to him. And a lot of times, if you have a hook, for example, a hook that hangs down, enter, visual aid.
I love visual
On
aids.
this first tooth, if you have a hook that's a wolf tooth, but behind that is a tooth, if it looks like an eagle's beak and it hangs down that direction, on the top it's going to be a hook. It looks like an eagle's beak. On the bottom it would be called a ramp. It looks like a ski ramp. That didn't happen overnight. That takes years and years and years to develop a giant hook right there. But then the horse is used to that, and then it gets to the break point where it touches the tissue below. It was fine the entire time until it got so big that it starts touching the tissue below it, and then they can't close their mouths or they can't chew properly. It mechanically prevents them from being able to chew. Then it's a problem. So it wasn't a problem for 20 years, but it is a problem when it on the 21st year. So all of these things are just, the answer is they all need to be looked at. I would much rather look in a horse's mouth and say, it's fine, let's look somewhere else for teeth. Excuse me, so I say that again. Let's look somewhere else for a problem. Then their mouth, but always a great place to start. So
yeah.
That answers
anywhere from nothing to something major could be a sign, really. So that's actually a perfect answer, because that leads me to my next question. So how often should a horse be seen by a dentist on average, I guess? And at what age would you start? Like, how old a horse would you start looking at? And then how often after that?
Great question. There are lots of misconceptions about this. One is that I hear people say all the time, well, I have a young horse and therefore I know he doesn't need his teeth done. And then another person will say, well, I have an old horse and therefore I know he doesn't need his teeth done. So I think either just young horses or just old horses need dentistry. That is a common misconception. Well, the answer is all horses need exams. I like to look at the foals just because I like to look at the foals. Who doesn't want to play with them? So usually if there's a foal in the barn, I'll just glance at it and see, does it have a parrot mouth? Does it have an overbite? Does it have an underbite? Does everything look normal in its tiny little mouth? That's if they're going to have a major problem. If a foal is born with a significant overbite, you can surgically do something for them, and you do it soon. As soon as they're like a couple of weeks old, even, they start correcting things like that. You can put braces on a horse, and it will pull their upper jaw back or their lower jaw back, whichever one is too far forward. But if you would wait till the horse is 6 months or a year, it's probably too late. Something that they start really early on. I typically tell people that I like to see them at least by the time they're going to ride them. Like, let's do their teeth before they're ever going to have a bit in their mouth. And that means different things to different people. I don't put a horse, I hardly ever use a bit in my horse. They go bitless, but that's just me. Some people put bits in their mouths when the horses are 1.5 and they're going to go to the racetrack, or they're just, some Western people start that soon, or just some people like to put a bit in the horse's mouth so that he's getting used to it along the way as his part of his training. If you're going to do that, it's a good idea if they have wolf teeth to take those out, because those are the little teeth that sit right in front of the first cheek teeth, and they are potentially in the way of the bit. So if you think you're going to do some bit work on a young horse, definitely you can take the wolf teeth out and maybe do a quick little float. When horses are 2.5 years old, they start to lose their first round of baby teeth, and it's sort of a traumatic thing for them. They lose 8 teeth, and then also they would have their wolf teeth in. So I think, as a good answer just for anyone, I think it's good to start right around the time that they're losing their baby teeth and you're going to be riding them. If they are never going to be ridden, it still doesn't matter. They still need an exam. So all horses need, we'll just say, like, all horses over the age of 2.5, when they start losing their baby teeth, really could use an exam every year. And we don't float them necessarily every single year. Some horses, just like some people, have much better teeth than others. I believe that a huge part of a horse's dental problems comes from the conformation of their mouths. I've seen this over and over. This is just like a common theme. Horses have some breeds have excellent teeth and some breeds have less excellent teeth. And it's not so much like the constitution of the teeth or whether they're crumbly or they have cavities or whatever. I can't generalize that to a breed, but I can generalize great conformation to certain breeds. And I find that the horses who have longer faces, like thoroughbreds, standard breds, Tennessee Walkers, they have plenty of room for their teeth. They got those long faces. But Arabs, quarter horses, miniature horses, ponies, they have broad foreheads and less length from their nose to their poll. So they have like these more squat faces, and there's more opportunity for overcrowding. When the teeth become overcrowded is when they don't touch correctly, and then you have one overpowering on another, and it just goes on and on like a dominoes effect. And I've seen a drastic change, for example, in the warm bloods. Like, I don't know if you'll find this in any scientific journal yet, but I'm sure that it will at some point. I just saw one yesterday. These European warm bloods that we see a lot in Ocala, they're being imported as 3 and 4 year olds, and then they're going through the training phase and being sold as young show horses. It is happening so often anymore that I'm positive that there is a trend that we see horses who have one, I call it Dr. and Mr. Hyde. They have one horse on one side of their face and another horse on the other. So they have a totally normal side of their mouth, and then the other half of their mouth is completely ridiculous. It looks like a train that has been derailed. So the first good side of their mouth will look like 6 train cars in a row that are just where they're supposed to be. And then the other one looks like every other car has come off the tracks. And maybe just on one arcade or one row of teeth. So the uppers look like that, but the lowers are straight. So nobody lines up. And then from a young age, they're starting already these overgrowths of teeth because the teeth are not matching up. It is so utterly important that the upper teeth and the lower teeth can match up. So again, the length of the horse's faces depends how their teeth go together. The breed, I think quarter horses and Arabians, to me, they have a lot of problems. And again, it's the shape of the face. I do believe that it's in the genetics of the horses too, and the breeds. I have seen families of horses where they have the same stallion that's breeding over and over and over. I can see these siblings, half sisters and brothers and full siblings who literally have an identical mouth. And you could write a chart and show, oh, this one came from this one, this one came from this one, because these are the same teeth. Humans are pretty sure that way as well. So anyway, there's a lot to it, and there's a lot more to it than anybody would ever think. Looking inside, we're not just looking for sharp edges, we're looking for the way all these teeth come together. So there are so many factors that play into that.
Yeah. Something you found actually on one of my horses when you were here, that he had all of that like tissue under his tongue.
Mm-hmm.
And you had said something about that, and I was kind of frustrated with leading up to that, not with you, but like I had struggled finding a bit for this horse forever. Like I tried so many bits, and finally I ended up riding him in a hackamore because it was like he was a completely different horse, bitless. And you were in that horse's mouth for like 2 minutes, and you were like, oh, look at all this extra tissue under his tongue. Like a lot of horses like this are more comfortable in a hackamore. And I was like, it took me like 8 years to figure that out.
Yeah, that's called redundant tissue. It seems like more warm blood type horses get that. What it looks like is bubble wrap almost. If you run your fingers along the bars of an average horse's mouth, the space between their front teeth and their molars, it's usually pretty flat and smooth, and you can feel the tissue quite closely adhered to the bone. But certain horses, you can grab that tissue. It feels slippery. It does almost feel like bubble wrap or saran wrap in there. And they just have so much of it that it oozes all over the place. It flops to the side. It goes down underneath their tongue. And when you're riding and you pull the bit back and forth, it will actually roll that tissue up over their first lower molar. They bite down on it. So there's absolutely nothing you can do about it. That's a confirmation of their mouths. These big, beefy warm bloods with the big, thick tongues and big lips, they will often have that. So you just have to be really cognizant of what bit goes in their mouth, that you have enough room. And or the hackamore or bitless is wonderful too, but it's not always practical for whatever purpose the horse has been being used for.
Yeah. Yeah. It was, you nailed it in like 2 minutes. Like, man, that would have been good to know years ago. But okay. That was a really great answer, because you actually hit like a couple of my other questions in your answer. So it was great. Okay, so how should someone choose a dentist? Like, what are things they should look for, or questions they should ask, or things like that when they're trying to choose a professional to do dental work on their horse?
That is a tough one, and we could talk for many hours on this. So the way it stands in our country is that in certain states, it's completely illegal for a layperson to float teeth. It's just flat out not allowed. In other states, the way they write the laws is that people who are not veterinarians can float teeth, and that just means taking off sharp edges. You cannot remove wolf teeth or do extractions or remove caps. It's simply the act of floating the sharp edges off of teeth. Other states are more lenient in what they allow, but the bottom line is no states allow non-veterinarians to sedate horses. If anybody is sedating a horse and they are not under the supervision of a veterinarian, then they truly are breaking the law. There is no place that allows a veterinarian assistant to sedate without direct observation. So it's a bit of a gray area. There are equine dentistry schools where they train you quite well to float horses' teeth and know the anatomy of the mouth. I went to one myself before I went to vet school. And I think a wonderful situation is when a certified veterinary technician who's gone through that program and been held accountable to a jury of their peers and have taken tests and done many, many hours in the field of floating horses, that they're very well trained and they're very good at what they do. And I have lots of veterinary technicians that I approve of their work, but they have to work closely with a veterinarian for the sedation part of it. And it's tricky because if you're a layperson and you're floating teeth and you're working with a vet and then the vet gets a colic call and they have to leave, well, they came and they sedated the horse for you, but then they're gone. And if you need more sedation, you're just there dealing with it. Or if the horse is too sedated, then you have that problem. It's not impossible. It's just tricky. So I guess what I'm trying to say is pick somebody who's certified, who knows the trade, who isn't just somebody who picked up a brochure on equine dentistry and decided that they're going to figure that out in one day and then they're going to call themselves a dentist. I had an experience years ago when I met a gentleman who came running up to my truck and wanted to chit chat about horse teeth and said, "Oh, it's so great. I just love being a dentist. And isn't it great that we're dentists?" And he was telling me his story and he said, "Well, I was being a used car salesman, and my brother-in-law works on the track, and he was floating horses' teeth. And he said, 'Hey, this is a great way to make money. You can just go down the shed row, and you can charge $25 a horse, and you just work all day. It's like really great money. Here's a catalog. Order these instruments and start floating these horses' teeth.'" And I thought, oh, okay. So honestly, there's not a lot of policing of who gets to do it and who doesn't. So you do need to do your homework as a consumer and find out who is floating your horse's teeth, because that guy had no training, and I'm talking no training. So, there was a large area of between that and then somebody who's the most highly trained dentist in the country. So, and the flip side of that is not all veterinarians are well versed in doing teeth. We graduate and they have to teach us a lot of different skills in a short amount of time. And equine dentistry is one thing that veterinarians, of course, can put on their list of sheets, the list of services they can provide. But whether or not they've had a ton of training in it, you need to ask. For example, I never palpate anybody's mares because, one, I don't want to. I'm an equine dentist. I do the other end. But the other reality is that when I was in vet school, there was not enough time in that 4 years for me to take equine reproduction. I took canine reproduction classes. That serves me very well. But the point being is, so I didn't get access to those skills. And I wouldn't sell myself and say to somebody, yes, I can tell you whether your mare's pregnant or not, because it's not my skill set. So ask your veterinarian, is it your skill set? How often do you do this? Do you like to do this? Are you good at this? Do you have any further training? Do you go for continuing education credits? Do you like to do it? Don't hire your veterinarian who doesn't like to do it, because a lot of people don't like to do it. You can find somebody who does like to do it. I sort of feel like anybody who floats teeth needs to have some kind of credentials that they have learned how to do it. if that makes sense. It's not something that you can learn in an overnight one weekend class. There is so much more to equine dentistry than anybody understands on the surface that you just can't learn it. You have to learn by doing, and you have to be in it a long time to have seen enough cases. So I wouldn't say no to a lay dentist, and I wouldn't say no to a veterinarian. There's just, you have to do your homework. There are governing bodies in the United States that you can look up on their websites, their certified members and how much experience they have and where they travel. And you can ask around, which you didn't ask me this question, but this is the number one thing that I want to say. If I'm on a soapbox, I think sedation is a wonderful thing. And I have had a lot of dental work done myself, personally, in my own mouth. And guess what? I love sedation. They put me to sleep. They put me to sleep, and they wake me up, and they hand me a pina colada. And they said, wasn't it wonderful? It's not alcoholic, of course. But I'm serious, because I am the worst dental phobe in the world. I am worse than all of you put together. I am the worst person for going to the dentist, and I think maybe that's why I do this for a living. I'm not sure. So I really don't think that there is anything wrong with sedating horses. And as a matter of fact, I think it is mandatory. I just personally think that there is no possible way on the planet to take a 1,000-pound animal or more and look in its mouth for an extended amount of time, do things in its mouth, do things it might not want to have done in its mouth, all without sedation. So we sedate horses with a very special cocktail in a very specific manner for the comfort and safety of me, most important, because I can't get hurt doing this, my veterinary technician, who's my right-hand man, who's like very important to me, the owner, who doesn't need to be hurt, and of course the horse, who doesn't need to be hurt. So by giving it a very small cocktail of some mild sedative that lasts only 15 or 20 minutes, you can get a most excellent job done. I mean, this is my biggest soapbox. You can get the most excellent job done quickly and efficiently without cutting or hurting the horse. So when I get on Facebook and I see these contests where people are like, I like this dentist. No, I like this dentist. No, you've got to use this dentist. No, this one doesn't sedate. My horse did not have to be sedated for his last dental, as if there is a prize for that. A big blue ribbon, a big trophy, and a bundle of roses that your horse didn't have to be sedated to go to the dentist. That is not an award-winning deal. That is a less than adequate job was done on your horse. I'm getting very opinionated about this, but I'm so passionate about it. Because I'm sorry, I have probably 5% of horses in my practice I could float with no sedation, because they're just good boys and good girls, and you could cut their leg off and they wouldn't move. But the rest of the 95%, no. And even of the 5% that would let me do it, after about 10 minutes, they're over it. And they're like, you've used up all of the good boys in this horse, and now I'm done, and I don't want to stand here. So, you know what I'm saying? Like, it's just, it's not what people think. I do believe there's a common misconception that people don't understand the difference between standing sedation and general anesthesia. And so let me explain that. Standing sedation is where you have a drug mixture and you inject it in the horse's jugular vein in its neck. And it's just a little bit sleepy, like it's had a beer or a glass of wine. Like it can still run, it could still whinny, it can still move, it can still, I mean, it might not do it very fast, but it could. It doesn't fall down, it doesn't lay down, and they're just in a relaxed state. They are arousable still. Now, some of them do get pretty darn sleepy with sedation, and I'm just kind of generalizing here. Versus general anesthesia is where the horse is laying down with gas being pumped into its lungs through a tube for surgery. You cannot rouse them. They are unconscious. They are in a surgical plane of anesthesia that is completely different. It is completely different. And they do put horses under general anesthesia for some dental extractions and some sinus procedures. And, sometimes we do send them to hospital clinics and they get put under general anesthesia. But For a regular float in the field, it is minor, mild, short-term, reversible sedation. Whew. Thank you for listening to that.
I love that.
Very important.
I like it when you get on a soapbox. Like, that's what I'm here for. I'm here for those good, hard-hitting soapbox answers. I like it. Okay, let's hit one from Keegan. Keegan always asks a bunch of great questions. I think we've already touched on a couple of them. So here's another. She said, what is TMJ? How common is it? And does it affect tooth growth?
Okay, so
We're back to the skull. I like it.
a little bit hard to do with my camera, like it is. So the temporomandibular joint is where the jaw, the lower jaw of the horse, and the skull come together. It's where they hinge. I just took the skull apart. Here's the lower jaw, here's the upper jaw. It's where they come together and they form a hinge, and that's what moves when you eat or talk. So there's a cartilaginous pad in that joint, just similar to like in your knee, which acts as a shock absorber for that joint. And horses can have pathology in that joint. They can have arthritis. They could have a damaged cartilaginous pad. They can have a blow to their face. They could have a broken bone around the TMJ. They can have injuries there. But the average horse who has quote unquote TMJ doesn't have pathology, if that makes sense. They have maybe a strain or a sprain or just some pain there that's not because something is torn or bleeding or the pad is, like if you do your meniscus in your knee when you're a soccer player, like something like that. They haven't had a big deal like that. But the TMJ is diagnosed a ton in horses because when you palpate that area, they seem painful. But I challenge you to walk up to anybody, or you can do it to yourself. Just put your fingers in your TMJ and press very lightly, and you'll tell yourself or whoever's doing it to you to please stop. Because there are lots of nerves there. It's not a lot of tissue. It's right over the bone, and you have a lot going on there. You have your neck the horse has their neck muscles, their facial muscles, their cranial nerves aren't far from there, the actual joint. So if you're pushing on that, it can be tender, even if it's not tender, if that makes sense. Like, it's not a comfortable thing to do. So a lot of body workers, acupuncturists, chiropractors, and dentists will palpate that area, and the horse goes, ooh, 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 no, don't touch that. It's not always because it's so painful. It's sometimes just because they don't want to be touched there. But if you think of a horse's mouth as a hinge, and it's opening its mouth 1,000,000 times a day, that's a very well used joint. And if you ask people to name the joints in an animal's body, they'll say stifle, hock, fetlock, blah blah blah. But they'll almost never say TMJ. The TMJ is probably the most important joint in a horse because it keeps them eating and living. So anyway, just to say that because it's a hinge joint like that, either the horse, potentially a riding horse, could be pulling against you, or you could be pulling against it. And what happens when that happens? You pull their lower jaw down like that. So there are a lot of soft tissues in that joint that can be either injured or at least stressed to the point of pain by somebody pulling on the horse or the horse pulling up on the person. For whatever reason, all of that, that could be, whether it's running away on cross country, or if it's a dressage horse and it's overflexed and it's pulling its chin in, or if it's just nervous and it just keeps pulling up against the bit and you didn't really do anything wrong. All of those things contribute to this pain in the TMJ. So I'm just trying to say that sometimes there's an actual physical problem, and sometimes it's just a tension or just a little bit of just tenderness there, not because it's got some catastrophic illness or damage to its temporomandibular joint. So what was the other half of that question?
Does it affect tooth growth?
Does it affect tooth growth? The horses are genetically programmed to have about 1/8 of an inch of tooth come into their skulls every year. Every tooth does that. So it doesn't affect tooth growth so much, but I maybe could guess that if a horse was tender in his TMJ, he might not bite down as hard to chew as a horse who doesn't have TMJ. I mean, if anybody out there has TMJ, human TMJ, it's painful. You wear night guards for it. People that grind their teeth all the time, they get very painful. So I would imagine that a horse might tenderly put its teeth together and not chew its food very well, and maybe not wear its teeth down as much as another horse who can voraciously eat. I've never particularly heard of TMJ per se causing teeth not to grow or erupt, I should say. Teeth don't grow in a horse. They have all the teeth they're ever going to have in their skull when they're born. So they have these pistons of teeth. They look 4 to 5 inches long, and they erupt in at a regular rate. So you really can't do anything to speed it up. The only thing that speeds up a horse's tooth coming in is if it has no occlusion, if it's lost its partner tooth, or the tooth above or below it is shorter than it is and it doesn't meet correctly, it will super erupt and come in a little extra. So if you have a horse that has a missing tooth, you need to have the teeth floated on a regular basis to keep the opposing tooth of this from the socket, the tooth opposing the socket, from getting too big. Because if the horse is middle-aged to young, it will keep on coming in for many different inches. Some horses you can even have a 2 to 3 inch overgrowth, and they really can't move them out. So that's what I think about TMJ.
So we have a question. Well, we have a couple comments in the chat just saying that you're everybody's favorite dentist. So, and then so we have a question from Pam who said, "Why does a horse sweat when waking up after sedation?"
Oh, because that is one of the side effects of the drugs: salivation, lacrimation, urination. It's just the way that the class of drugs works on the body, and it just causes that to happen. I mean, we could go in the pharmacokinetics of it, but it is perfectly normal. Not all horses do it, but some horses excessively sweat. You'll see even in the wintertime, they'll start pouring sweat from underneath their manes and their forelocks usually. It's not abnormal. If you look on the drug insert, it is a side effect. Some horses transiently get hives once in a blue moon. Most horses will pee as soon as they wake up. A couple times sometimes. It's just part of the alpha-2 agonists we use, like xylazine and dormocidine and tomidine. That's just a normal side effect.
Okay. Cool. So, okay, this one I'm interested in. Have you seen any issues with slow feed hay nets causing abnormal tooth wear?
I have muzzles in some cases, and slow feeders. They will rake the tissue up from between their. It's so hard for me to find the camera. There we go. They will rake the tissue that usually is between the teeth. They will rake it up, and it won't be there anymore. And it will be sometimes bleeding or at least sort of ulcerated. But I look at it this way: if it's not slowing down their eating, that they have these sores in their mouths and they're not terrible. I love slow feeders, and I love the idea of slow feeders. So I think that if the horse doesn't seem bothered by it, bring on the slow feeders, or maybe try a different sort. I mean, I've seen it where they're bleeding and really nasty. Like, I would change that horse's situation. But those pasture bales that are compressed, the alfalfa blocks and all that, they're very compressed. So the horses have to sort of gouge their teeth at them like really hard, and try to break off the pieces of hay. So that's going to happen. And then some of the slow feeders that are like balls that you stuff with hay, or just hay nuts that have little holes in them. Again, if it's not like super traumatized, I think it's fine. I really do like the idea of slow feeders. I have horses that would eat their body weight in hay in 1 minute if they could.
Yeah. Same.
Yeah.
Okay, so let's see. I'm trying to hit all the major ones so that we make sure we have time. Okay, so what are wolf teeth, and what are the potential issues for a horse that has not had its wolf teeth removed? I love we're going to the skull again.
So the wolf tooth is that little white tooth in front of the gold teeth. The pink is the bars of the mouth, and that wolf tooth is the first little tooth right up against the first cheek tooth of the horse. So nobody really knows why they have them. Those are, I think maybe it might be from the saying, like a lone wolf. That tooth stands alone. We don't know why they have them. They are potentially in the way of the bit. So there's a misconception that that is a stallion's tooth. That is not. Those are mares and males have that in almost the same frequency. It's the canine teeth. The yellow ones right next to their incisors. Those are canine teeth. Those are the stallion's fighting teeth. So those are the male's teeth. If you can see the teeth when you part the horse's lips to put the bridle on, those are the canine teeth. And once in a while, mares will have little tiny ones, and once in a blue moon, mares will have 4 fully erupted canines. And if I try to steer clear of them.
Now I know next thing I'll be really. I'm gonna have to check my mare's mouth now. I don't know.
Yeah, I can make the people think I'm psychic, but I say, is your mare the boss? Is this horse the boss of the herd? Oh yeah. How do you know? Well, because she has 4 fully erupted canines, and she's gonna rip somebody else apart. So
now you've started something for me, because we have a farm full of mares. It's a breeding farm. We have a farm full of mares. So tomorrow you're gonna see me out in all the pastures.
Most of the time they have little tiny canine teeth that are barely through the tissue, or they look like a grain of rice. But the wolf teeth are further back, and they too can be about the size of a grain of rice, or the size of my pinky finger, or the size of my thumb. And whether or not they need to come out is determined by whether or not the horse is ever going to get ridden. If it's a lame racehorse with a broken leg that's healed and never going to get ridden, then, well, he probably would have had him taken out before he raced. But you know what I'm saying. A horse who's never going to be ridden, you certainly don't have to take him out. And then they can be in line with the first molar. They can be to the side of the first molar, to the outside, or they can be tucked around the inside where they couldn't possibly ever touch a bit no matter what. They just can't come in contact with it. So I tend to just sort of leave it up to the owners. Like, if it's not going to ever come in contact with the bit because it's positioned what we call palatally, or like on the inside edge of the tooth up by the palate, there's no possible way a bit could hit it. Then we just leave them in. It's not going to hurt the horse. But if it's in the front of the row of teeth, or if it's sitting to the side like a tusk sticking out sideways, 100%, I think we should take them out. It's not hard to take them out. It's easy to take them out when they're young. It's not any big deal at all. You give them a little bit of lidocaine and a little sedation, a little lidocaine. They don't feel it. You pop it out and you never have to worry about it again. But do I think they always have to come out? No, I don't.
We have another question in the chat. So where should a bit sit in the horse's mouth?
Okay. Most horses, the bit will sit about an inch in front of the gold tooth, the first molar there. The bit will sit about an inch in front of that. So you can see how the wolf tooth could be in the way. That little white tooth is the wolf tooth. Mm-hmm. There's an old rule where they said a snaffle bit, you should have 2 wrinkles, and a curb bit, you should have 1 wrinkle in the lips. But horses have varying lengths of mouths, from their incisors, the blue teeth, to their molars, their gold teeth. That is a highly variable distance. And if you start to look at horses just as you're walking by them, the outside of their faces, you can see some have really short mouths, like 2 or 3 inches to the corner of their lips, or some have like really long mouths. But what's important is the distance between the corner of their mouth and their molar. When you put your bit in the horse's mouth, it shouldn't be smiling so much that you're pulling its lips back. I mean, most horses won't tolerate that. Nor should it be so low on a male horse that it would be hitting these canine teeth. Number one bit fitting issue I see is when people try to be kind. They think they're being kind, and they're allowing the bit to be too low in the horse's mouth, and it hits that upper canine. And most people don't even know they have upper canines because it's sort of hidden by the lip. So you can see if it's going to hit the lower canine. That would be very low. But you have to make sure it doesn't hit the upper canine. So when you put a snaffle bit on your horse, your gelding, your stallion, look inside its lips and make sure when you pull the bit mouthpiece down that it's not touching that canine. That's a whole another lecture of bitting, right? So, but that's like the very basics of fitting a snaffle.
Okay. So we have Steph asking in the chat. She said, can you talk to us about blind wolf teeth? Because Gary had those and she didn't ask enough questions at the time.
Yep. A blind wolf tooth is, so you see where this wolf tooth is, it's just in front of the first cheek tooth. A blind wolf tooth is like an impacted wisdom tooth. It's about an inch in front of the average wolf tooth, and it never comes to the tissue. Instead of pointing down and having a root and looking like the one I just showed you, it looks like a little pearl underneath the skin, and it never comes through. And I like to think of it as the princess and the pea. So you can't see them, but you can feel them. But the tissue is very loose there. So a lot of times people don't feel them. And if you're not specifically feeling for them, a lot of times even the dentist will miss them. But I usually see them, they look like they have a red bullseye or a bagel donut shape over that tooth because the bit has hit it so many times and it's sticking down, but it's not through the tissue. So it makes a little dot and then a circle around it. So It's a tiny surgery. Again, you just give them a little bit of lidocaine, numb the area, scoop it out. It comes out like a pearl out of an oyster or a pea out of a pod. And the horses are usually so much happier after that. They really can cause problems long term. So any oral exam done by your dentist or your vet would involve looking for these teeth. The last one I found was in a 12-year-old horse who had always had trouble going to the right. So took out the wolf tooth. She never had a problem again.
Well, I didn't even know that was a thing. So I learned something. I've learned a lot of things, but
Not
that's
so common.
anyway.
Maybe
Okay.
5 times a year for me or something like that.
Okay. Well, Steph had a special one, I guess. Okay, we got, so Krista said in the chat, some Western people put the bit super low. Is it different for a Western bit versus an English bit where it should sit in the mouth?
Not at all. I actually had that experience. I went to a clinic myself riding. I am of the English persuasion, but I was riding with somebody who was riding Western, and they thought that they should put their bit very low in the horse's mouth. And like I just showed you the canines, it was actually hitting the lower canine of the horse, and it was actually going in front of the lower canine. It was going between the incisors and the lower canine. And I stopped to sort of show this lady what was happening in there. She was under this misconception that I've heard in the horse world, where if horses are carrying the bit correctly, that they will take their own tongue and they will hold the bit to the roof of their mouth once they're properly in collection and moving correctly, that they will know to take their tongue and hold the bit to the roof of their mouth in the proper place. But that is baloney, beyond all baloney. Your tongue is a muscle. You can't even hold your tongue to the roof of your mouth for 10 seconds because I would time you and you would probably start thinking about something else before 10 seconds went by. And you wouldn't be able to do it anyway because your tongue would get tired. And if you think that soapbox, warning, soapbox, the horse is galloping around and he's breathing and he's trying to do all the things you're asking him to do. And he's trying to stand up with you on his back and your hands are moving, and the bit is moving and his tissues are moving and he's breathing. And did I mention he's galloping and he's supposed to hold his tongue, to use his tongue to hold the bit to the roof of his mouth? No. I'm sorry. That can't happen. That cannot happen. So if I was going to be on my tombstone, it's going to be like, no, horses cannot hold the bit to the roof of their mouth. Can't do that. And so it's not so kind to just have a really floppy, loose bit. I think it needs to be snugged up to the corners of the mouth a little for some support. So the bit is not moving around, clanking them in the teeth. And when you hear that little clank, clank, clank sound, it's typically in a male horse, it's hitting those canine teeth. And the canine teeth look like they're only like the tip of my pinky finger, but they're not. They are rooted along the bars of the mouth, and they're like 3 to 4 inches long. They're their tusks. They're meant to stay in there when they bite something. So you don't want that bit anywhere near those canine teeth.
Gotcha. Okay. We've got another one from Steph. Boy, now we're going hot and heavy in the chat. I like it. So she said she also has a really bad cribber, and sometimes she feels like his teeth get sore. Is there anything I can do to help him with the sensitivity? He also gets abnormal wear patterns on his canines and needed a filling once. Will that need a touch up at some point?
A filling and a molar would need a touch up at some point because horses constantly erupt their teeth and wear them away. But the canine tooth is the only tooth in the head that is a human type tooth, where it comes in at a certain age and to a certain point, and it never erupts anymore. So once it has a filling, that filling should be fine. I've never seen a horse that I thought was painful because he was cribbing. They can do a lot of damage to their front teeth, and I don't think they're terribly painful, but they can crack them and break them and all that. I don't really know what to do. We can't put Ambisol on there. I don't know that they're excruciatingly painful in their teeth. It might be painful in their TMJ from pulling back. I have seen that. They constantly are pulling back and hinging their jaw and just making themselves sore back there. So I don't think, unless we can get into their minds and say, please stop cribbing. I read an interesting paper the other day. This does not need to go crazy on the internet, but I did read that they were testing the chemicals in a horse's brain in general, doing MRIs and studying what people who study horses study, saying that there's some link between the chemicals they're finding in a horse's brain, the brains of horses that crib, and schizophrenics. Interesting, right?
Oh, that kind of tracks for Steph's horse. Yeah, okay.
So, all right.
That's really interesting. Now I want to read that.
We can't have a whole talk about that. That was just in a veterinary journal. Okay.
Okay. Okay. So Libby wanted me to make sure I asked you this.
Hi,
What's the
Libby.
weirdest thing you've found in a horse's mouth so far?
Hands down, a big stick stuck in the horse's roof of the horse's mouth. A horse who had no symptoms whatsoever, no clinical signs, no anything. It was a wheeler horse of a very fancy driving team of four in hand, and the horse was having a routine dental, no symptoms whatsoever. He did not have a care in the world. He didn't have bad breath, and he had a stick, probably 4 inches across, stuck in the roof of his mouth. Long term, had been there for years. I'm pretty sure it had been there for years because this tissue had grown around it. And when I took it out, you could see the palatine arteries, which is the artery that feeds the teeth. When you put your tongue behind your teeth, you can feel the tissue there. The palatine artery makes like a horseshoe shape in the back of your teeth. And so this stick was like right on top of the palatine arteries, and you could see them pulsing when we took it out. That's the one craziest thing. Second craziest thing, which really isn't as crazy at all, was that botfly larvae grow and develop in between the horse's teeth, and they happen to be fluorescent pink, like my shirt, like fluorescent pink. And they dive in and out of the horse's teeth as you're looking in there. And when the light comes on, they hide in between the teeth. And if you take your light away, they come back out, and they look like pink neon gummy worms. Deworm your horses.
No.
You asked. You asked.
That's nightmare fuel. I don't need that. Okay, so we're kind of towards the end of our time. So is there anything we haven't covered that you feel like is important for us to know, or are there topics that you wanted to hit on while we have you?
Me?
Yeah.
You already got my soapbox. I just think, just to review for a second, it's perfectly fine and recommended to have a sedation exam done on your horse. Anybody who floods your horse's teeth needs to use bright light, a full mouth speculum, which is the instrument to open their mouth. It is not an instrument of torture if used in a sedated horse who is relaxed and accepting of it. So they use a speculum, a light, and restraint. And all horses need an exam once a year. Whether or not they get actually floated depends on their conformation, the status of their teeth. I think a lot of times the people who think older horses need to be done all the time, that's true and also not true. If you have a horse that you've done for years and years and years and years and years, sometimes they get to coast in their dentals when they're like 18, 19, 20, 25, because you've done so much good work leading up till then. A horse's teeth stop erupting around age 20 or 21, so they're just holding a place. So if they're all nicely balanced and floated and they don't have a lot of sharp edges, they're not going to be continuing to erupt any more tooth into their skull. And so you just have these nice rows of teeth holding a nice place. And I've seen 30-year-old horses who have been done so nicely that all along that they look like they're 10 years old. It's the 25-year-old horses who've never had their teeth done who come to me, and they're just so far gone. You can't give them dentures, and you can't stop the abnormal wear. They've used one tooth as a battering ram on another one. It's just too far gone, just like people. If you didn't go to the dentist until you were 75, there's going to be a lot to do. So all horses once a year, if you can, just have a quick peek in there, or to do whatever they need to have done.
Perfect. Awesome. Well, thank you so much for giving us your time. I really appreciate it because I know you're busy.
Pleasure.
I feel like I could talk to you for a long time because
I think I could talk about this for a very long time.
I love your soapboxes. I love your weird, gross stories. So thank you. And thank you, everybody, for sticking through our technical difficulties. I'm sorry for that. And thank you, Dr. Bess, for being flexible. I really appreciate it. And for bringing your horse skull, because visuals are always amazing. So if you guys are listening to this later, you might want to watch the actual video because she is showing us lots of stuff on a skull that's pretty neat. So awesome. Thank you so much for joining us, Dr. Bess. And thank you, everybody, for tuning in.
Thank you for having me.
Awesome.